extreme pleasure to welcome our very acclaimed doctor, Dr. Prazan Mistry, who is present here with us, and he will answer to some questions regarding today's topic, which is intrauterine devices. So doctor, before jumping to the questions directly, please tell our viewers something about yourself.
I'm Dr. Prazan Mistry. I'm a consultant obstetrician, gynecologist and infertility specialist practicing in Mumbai. I'm the founder director of Gynafem, the complete gynac and fertility solutions clinic. I'm attached to all the major hospitals in South Mumbai, including Saifi, Bhatia, Wokhar, Elizabeth, Masina.
Alright, thank you doctor. So moving on to our very first question, which is doctor, what is IUD, intrauterine device?
IUD or an intrauterine device is a small T-shaped plastic coil which is wound out with copper core. It's basically inserted inside the uterus or the womb of the patient. Initially, it was used basically for contraceptive purposes, but now it has been used for many other purposes. It is one of the most safe, effective way of contraception. Basically, there are two types of intrauterine devices. We have the hormonal one and the non-hormonal one. The non-hormonal or the copper device is the one which is commonly used for contraception. Just after insertion, it's almost 99% effective way of contraception. That is, the failure rate is as less as 1%. After inserted, it acts immediately and the action lasts for around 5 to 10 years depending upon the type of the intrauterine devices. After removal of the device, the patient can get pregnant immediately. Though there are small incidences of pelvic inflammation or pelvic infection disorders associated with the devices, the device may be also pushed out of the uterus, but with the help of your doctor and the nurse, you can actually judge as to what is going on with you. So just to put it in brief, copper device or copper T is one of the most safe, effective and the reversible form of contraceptive device which is available in the market.
Alright, thank you doctor. So as you said about hormonal IUD, so doctor, could you elaborate on this topic?
Like I said, there are two types of intrauterine devices. One is the hormonal one and one is the non-hormonal one. The hormonal IUD are basically intrauterine devices which are small T-shaped plastic core which have the hormone embedded in its stem, and the hormone generally routinely used is the progestin hormone. This hormone basically acts by mainly two ways. Number one, it thickens the cervical mucus, so it prevents the entry of sperms inside the uterus. Number two, it thins the uterine lining, and in some way or the other, it also prevents ovulation. So by these three main actions, the hormonal device generally plays its role in contraceptive purposes. Initially, like we said, that basically used for contraception purposes, the hormonal devices are now used for varied other purposes. They're basically for number one, heavy menstrual bleeding, number two, painful periods, number three, basically for fibroids, number four, for abnormal uterine lining growing inside the uterus, which is called as a hyperplastic endometrium, or the abnormal amount of lining growing inside the uterus, which is called as adenomyosis. Generally, the hormonal devices give an action of almost 7 years.
Will a hormonal IUD cause weight gain?
Talking about the intrauterine devices, as we said that there is a hormonal and the non-hormonal one. The non-hormonal or the copper T device is not generally associated with that weight gain, but it is seen with some cases in the hormonal device, that is only in 5% of the patients there might be association of the weight gain. Now it is very important to tell our patients that the weight gain is basically not due to the fat gain, it's basically only and only due to water retention, which is due to the hormone progestin which is present in the hormonal device. This progestin hormone causes a bit of water retention, and that can cause a weight gain in only 5% patients. Generally, the weight gain is almost only 0.72 kgs gain in 1 year, and basically it reverses after 3 to 4 months of insertion. So there may be a weight gain. Like I said, that once the devices are out, the weight gain generally comes back. The patient loses its weight because it's only and only purely based on water retention and not basically because of fat gain.
Doctor, so doctor, what are the pros of IUD?
Number one, the pros of IUD is, number one is it is very effective. It is one of the most effective form of contraception which is available. Like I pointed out, it's almost 99% effective and the failure rates are less than 1%. Number two, the longevity. That is, the copper devices, either the hormonal, the levonorgestrel devices or the copper devices, generally give a protection for around 5 to 10 years, which is good enough years for a contraception. Number three is convenience. There is no need, like a condom, to just be prepped up before the sex. So once it is put in, it is inserted, it is there inside for 5 to 10 years. Number four is cost effective. Though the intrauterine device may be costly at a first hand purchase of the device, but once inserted, it's generally stress free for the next 5 to 10 years. Number five, what we can say is, in certain cases of hormonal devices, like we pointed out, that besides contraception, they give also other benefits, which are reduction in the heavy bleeding, give painless bleeding. That is, in cases of certain patients who have pain during periods, that can be lessened down. There are certain conditions like fibroids or adenomyosis or endometriosis, which are generally difficult to treat, can be controlled with this form of hormonal devices.
Okay, doctor. And on the other hand, what are the cons of an IUD?
The cons of the IUD are basically, in certain cases of copper devices, they are sometimes associated with heavy painful bleeding, which is one of the most common causes of discontinuation of these devices. Besides that, it doesn't give any protection against the sexually transmitted infections, which is in cases with the condom. So if you want to get protected with the sexually transmitted infection, you should be using another form of contraception, like a condom associated with that. Number three, if the IUD has been inserted in an active infection, it can cause pelvic inflammatory diseases or pelvic infections, which further can cause difficulties in which can cause further complications, difficulties in getting pregnant. So basically, these are the most common causes by which women generally tend to discontinue using copper devices, is because of the heavy painful periods. And again, sometimes copper T, once inserted, you have to routinely undergo a checkup for the copper T, whether the threads or whether the copper T is displaced or not. So you need not more frequent, but sometimes frequent visits with your gynecologist to check whether the copper device is in situ or not.
Pelvic inflammatory disease, which is PID?
The IUD generally doesn't cause pelvic inflammation or the pelvic inflammatory diseases, but as during the insertion of the IUD, it may result into insertion of the infection inside the uterine cavity. The commonest organisms, or the commonest bacteria and the viruses which generally cause these sexually transmitted infections are the chlamydia and the gonorrhea infections, which may be precipitated and triggering the PID. That is why many a times the doctors generally tend to check you for these diseases or the disorders before inserting an intrauterine devices. Now, the chance of introducing an infection inside the uterine cavity and the chance of having a pelvic inflammation goes almost sixfold in the first 20 days, and it is rarely seen in the women after 5 years of their intrauterine device use. Most of these women having an intrauterine device with a pelvic infection are a higher chances in the basic age bracket of less than 25 years. So if you are less than 25 years, your chances of having a pelvic inflammation resulting from an intrauterine device is almost 2 to 3 folds as compared to one who is more than 25 years of age. So that is why IUDs are generally preferred in stable partnered couples.
Doctor, can young women and older women use IUDs?
So the wonder of this IUD is it can be used at any age group. It can be used for the younger ones as for the adolescent ones, and also for the women who are more than 40 years of age. It can be used in women who are married and women who are not married too. It can also be used in the cases where a woman is generally tending to do hard physical activities. It can also be used just after a miscarriage or an abortion. It is very safe to use in breastfeeding too, and also it can be used after any treatment of ectopic pregnancy. So looking at the spectrum of these conditions in which the IUD is used, it is generally a wonder contraceptive device.
Yes, doctor. And doctor, how effective is an IUD?
As I pointed out earlier, IUD is almost 99% effective as a contraceptive device. That is, the failure rate of IUD is less than 1%. Again, the good part about IUD is it's completely hassle-free. That is, once it is inserted, it stays in place for almost 5 to 10 years. So you just put in and forget. Number three, it may have a one-time cost associated with it for the purchase and buying of the IUD, but after that there is no cost for maintenance. Another one thing, good thing about the IUD or the intrauterine devices is it can be used in various spectrum conditions, like I pointed out, in adolescent, in married, in unmarried women, in and women more than 40 years, in women who are breastfeeding. So because of this wide spectrum of the conditions in which the IUD is very, very safe and effective, the IUD is as effective as almost 99%. As we pointed out, the two types of intrauterine devices which are available in the market are the hormonal one and the non-hormonal one. The non-hormonal one, as we said, is mostly a copper device or a silver device. The copper core generally renders the sperms powerless, and that's why the sperms cannot travel through the egg. There is no fertilization, and because of no fertilization, there is no pregnancy. On the other hand, in cases of the hormonal devices, like we pointed out, act in basically three manner. One, they thicken the cervical mucus, so they prevent the entry of sperms inside the uterine cavity. Number two, they render the lining of the uterus, which is where the baby is going to get implanted. It makes it very thin, so it prevents the implantation of the baby inside the uterus, and at some extent, it also prevents ovulation. So that is the mechanism of action of these two types of intrauterine devices.
Yes, doctor. And doctor, does an IUD insertion have to be done at any specific time during the menstrual cycle?
The intrauterine device can be inserted at any time of the menstrual cycle. However, a negative pregnancy test documentation is a prudent for it. Idealistically, the intrauterine devices are generally inserted during the periods, which again gives us two advantages, is that it points out that the woman is not pregnant, and also the mouth of the uterus, that is the cervix, tends to open up for an easy insertion of the device. But however, if it is when it is inserted at any other time during the menstrual cycle, a negative pregnancy test documentation is very, very compulsory. If the intrauterine device is inserted at the latter part, that is during the end of the cycle, in which our medical terms we call it as the luteal phase, it is very important that the patient uses or the couple uses any other form of contraception, non-hormonal contraception, till the next period is due.
Alright, so it's time for a short break now. We will see you in next few minutes. Narikaa talk show again. Moving on to our next question. Okay, doctor. So, doctor, what testing is required before a woman can have IUD inserted?
So like we pointed out before, a general routine pelvic examination is mandatory before the insertion of the copper device, because it gives us a rough idea whether the uterus is in place or are there any other masses or fibroids in the uterus, which can be again corroborated with an ultrasound, a pelvic ultrasound, which can be put in place. Like I pointed out earlier, the copper device or the hormonal or the non-hormonal device can be inserted at any time of the menstrual cycle. However, a negative pregnancy test is warranted, so it's always better to check a pregnancy test before putting in a copper device. Again, when we spoke about the pelvic infections, some of the doctors tend to check for chlamydia and gonorrhea, which are the routine and common sexually transmitted infections associated with the copper device, and also in the cases of certain forms of cervical erosions, a cervical cytology or a pap test is generally warranted.
Okay, doctor. And doctor, how is an IUD basically inserted?
An IUD or an intrauterine device is inserted as an office setup or an office procedure. Basically, a painkiller, that is an ibuprofen or a paracetamol, is generally given an hour or half an hour before the procedure. The cervix, that is the mouth of the uterus, is visualized with an instrument which we generally routinely use, which is called as a speculum, which is inserted inside the vagina to expose the mouth of the uterus. The copper T is folded itself inside a narrow tube which goes through the vagina, inside the cervix and inside the uterus. Once inside the uterus, the tube is withdrawn and the copper T sits in place. The strings which are hanging out are cut just short of the vagina. Though some of the patients may experience a bit of pain, spotting and bleeding after the procedure, patient generally goes back home the same day.
And doctor, is intrauterine device insertion painful?
Talking about the intrauterine devices, I would not say that the intrauterine device insertion is painful, but yes, there might be some form of discomfort which might be associated with the intrauterine device insertion. Most of the times, your doctor will give you an over-the-counter painkiller, generally in half an hour or an hour before the insertion. Some of the doctors also spray an anesthetic solution over the cervix or the mouth of the uterus. After the insertion, the patient may feel a bit of a cramping or the pain after just post insertion, which generally settles down an hour or two after the procedure, and the patient goes back home the same day.
Doctor, how quickly do IUDs start working?
The intrauterine devices start acting immediately after the insertion, and that is why they are commonly used as a form of interceptive method also. In our language, interceptive are the emergency contraceptions. So a copper device, when inserted, immediately acts and causes disturbances in the pregnancy and will not allow the pregnancy to grow. However, in the cases of a hormonal devices, it is generally effective only if it is inserted in the first 7 days of the periods. So if you are really cautious about it, you can use another form of contraception for 1 month after the intrauterine device is inserted.
And doctor, are there any side effects after insertion?
After insertion, like we said, the pain and the cramping form a most important form of side effects which are generally associated with either with the hormonal or the non-hormonal devices. Also, there might be a certain form of bleeding which might be associated between the periods, which we call as menometorrhagia, which might happen more so in the cases of hormonal devices.
And doctor, do IUD cause abortion?
IUDs are generally not associated with abortions. More so, IUDs are basically, like we said, is inserted in the cases of emergency contraception. However, on the other hand, we have also seen pregnancies staying in the uterus with IUD. As we pointed out that IUDs are almost only 99% effective. In 1% cases, we might also report a pregnancy along with an IUD, and the pregnancy may still continue. So IUDs are generally not associated, or they are the causative factors for abortions.
Does IUD make women infertile?
So generally it is a myth that most of the patients consider that intrauterine devices are associated with pelvic infections. Like we pointed out, the pelvic infections are generally caused because of the insertion of an infection in a previously infected cervix or the vagina during the insertion of the intrauterine devices. So most of the chlamydia and the gonorrhea organisms tending to cause such infections, which may further on disturb the lining or block the tubes and render patients infertile. But that is generally a myth because it is hardly seen in 1:100 women of the insertion of the copper devices. When inserted correctly, the copper device or the hormonal device doesn't result into any infertility in the patients. More so, it is rather a myth that most of the hormonal devices or the non-hormonal devices will result into either miscarriages, ectopic pregnancies or infertilities. So just to point it out in a blank statement, no, the IUDs will not cause infertility.
Alright doctor, and doctor, what are the risks of using an IUD?
And intrauterine devices are contraindicated in the cases of number 1, sexually transmitted infections. Like we pointed out, that intrauterine device doesn't protect against the sexually transmitted infections. Number 2, in cases of active infections and a history of pelvic inflammatory disease or a pelvic infection. Number 3, in cases of pregnancy. Number 4, in cases of any cervical or uterine cancers.
Alright doctor, and doctor, does it hurt when the IUD is inserted?
As we said, the IUD may cause a mild discomfort in the patients, but they are generally not painful. After the insertion, there might be a pelvic discomfort or a frequent bleeding or a spotting or a pelvic pain which might be associated with the intrauterine devices, which may persist for even as long as 3 to 6 months, but they can generally be treated with the over-the-counter available painkillers like paracetamol, ibuprofen, acetaminophen. So generally IUDs are associated with a mild abdominal discomfort but seen in very few women, and that can be treated with the routine over-the-counter available medications and painkillers.
And doctor, when should it be taken out?
So generally intrauterine devices are different types. So there are intrauterine devices like the Paragard generally has a validity of 12 years which can be taken out after 12 years. Mirena has a validity of 7 years which can be taken out after 7 years. Kylena, which is another intrauterine device which can be taken out after 6 years. 1 minute. We can continue this, right?
Yeah.
Liletta can be taken out after 5 years and Skyla can be taken out after 4 years. Intrauterine devices are also removed in the cases of suspected pregnancy and pregnancy confirmed. It is also generally taken out when there is an associated heavy bleeding or a lot of discomfort which is associated with an intrauterine device, which is generally not controlled with the medications. It can also be removed once the menopause sets in.
Yes, doctor. And doctor, how is an IUD removed?
The intrauterine device can be removed by a doctor at any time of the period or any time of the menstrual cycle. Generally, a forceps is introduced and the strings of the intrauterine devices are held and the intrauterine device is pulled out. So the arms of the device is generally coil by itself, they coil on itself, and the intrauterine device is generally taken out. It is rather more easier, less painful and less problematic than that of the insertion. It can be removed, like we said, during any time. You should, number one, you should not try to remove it yourself. Even if you're removing it and you want to still continue with your contraception purpose, you should be using another form of contraception starting 7 days prior to the removal of the intrauterine device, and you should continue taking the other contraceptive measures for the next 1 month till the next period starts.
Yes, doctor. And doctor, can an IUD make it more difficult for a woman to get pregnant in future?
As we pointed out earlier, intrauterine devices doesn't cause infertility. Second great thing about an intrauterine device is the action is generally reversed immediately after the removal of the device. So if you want to get pregnant, you can start getting pregnant and start trying to get pregnant immediately after the device is being removed. Since it acts locally on the uterus, there is no hormones which are affected, and that is why IUD is generally safe, and IUD will not cause difficulty in getting pregnant or infertility in the future.
Consult a doctor or other healthcare professional.
So as we said that after the insertion of the intrauterine device, it is very important to check the strings of the intrauterine devices, because that will guide you whether your intrauterine device is in place or not. So if you have been checking the strings of the intrauterine device and suddenly if you feel that you're not being able to find them, you should be contacting your healthcare professional. Also, number two, when you miss your period, you have to contact them, because there is a chance, though we pointed out that they are almost 99% effective, there is still a chance of 1% that there might be a pregnancy associated. Number three, if you have a heavy menstrual bleeding, that is again when you should consult your healthcare provider. If there is a persistent lower abdominal pain, you should be consulting your healthcare provider. If there is high fever just within the 3 weeks of the insertion of the intrauterine device, because that's when we said that the pelvic infection sets in, you should consult your doctor or a healthcare provider, or when there is a foul smelling abnormal vaginal discharge which is generally noted. So these are the situations in which you should be visiting your healthcare provider or a doctor after the insertion of the IUD.
Alright, thank you doctor for sharing your informative views on it, and I hope this session was really helpful and beneficial to all the lovely viewers out there. But before leaving, doctor, is there anything else that you would like to share with our viewers?
Okay, I really hope that this whole series has been really useful to the people out there, because even when we are aware of, even when in India, where we know that contraception forms a very subtle topic to talk to, not many people are open about talking about contraception. It's very important that the women in the country are aware about the contraceptive devices which are available. Whenever we are talking about the contraception, we always give them a cafeteria approach. That is, we have a lot of contraceptive devices available with us. We have the injections, the condoms, the pills, the intrauterine device. It is just that the woman should decide what is right for her. So I hope you have decided what is right for you and you choose the best contraception for yourself. Thank you.
Well, doctor, that was really a great response, and it means really a lot to us to be with you in the Narikaa talk show. And thank you a lot.
Thank you.
Thank you for patience.